Good morning. Welcome to ACC 19. My name is Beth Hill. I'm a general cardiology fellow at Scripps Clinic. I'm joined by Dr. Little, a staff cardiologist at Houston Methodist Hospital, also directs the cardiology fellowship and is medical director of the valve clinic. So happy to have you here with us today.
Thank you. Happy to stop by.
So understanding kind of your background in structural heart disease and 3D echo and TE with all of that, how would you say that ACC helps fellows understand that and build that into their career a little bit better?
I mean, I think of what ACC's done with fellows. So I've been coming to the ACC meeting since I was a fellow, which seems like a long time ago. And the benefits are the networking, absolutely. And I see our fellows. We have a lot of fellows from our program here, this meeting. Just seeing who they're talking to, the conversations they're having, the new science they're getting. It strengthens our program. It brings, they bring that back with them. They get to meet their mentors. It's funny, they often have more time with their mentors at this meeting than they do at the hospital because there's downtime and there's the ability to talk and meet and discuss, fun stuff. As a fellow, you find out about all of the studies, the big ones that are happening right now. You're in the room, you see the people, the leaders present the stuff, the key opinion leaders. You see the questions they ask, how they answer them. I'm amazed by the poster sessions. I just came from the posters. I mean, that's a zoo. There's a ton of data happening right there. And you get to meet your colleagues, but you get to sort of benchmark yourself. What are the great posters? What's drawing attention? What's the poster that nobody's looking at?
Yeah.
And that's some subtle feedback on how to, be, an emerging professional in this field. So there's just a ton of good stuff that's happening.
Absolutely. And kind of speaking to the breadth of what's going on here, how would you suggest that someone even navigate that and not get too overwhelmed by all of the programming that's offered?
Yeah, there's a lot of concurrent activity. Scheduling is key. You have to have a schedule, but you can't be too rigid.
Sure.
So you'll find things that somebody just says, hey, let's go to this thing, it's amazing, or so-and-so speaking and you've never seen them talk. My approach is I tend to look for great speakers. And you sort of figure out who they are and any topic. So I've got a short list of people that I've looked to since I was a fellow, and whatever they're talking on, I go see them.
Great.
Because I learned something different. And, I'm pretty subspecialized in what I do professionally, valve stuff, imaging stuff, fellowship stuff. I try to force myself at this meeting to go to the content that I'm not going to get at home. So, I honestly don't go to a lot of EP, but I do go to general cardiology and coronary stuff and, activities that, you really have to force yourself to identify where your knowledge gaps are and go there.
Great.
Yeah.
And to close up here, was there one trial or one session that you were most excited about or most looking forward to?
Well, I think that I got here pretty early this morning for the low-risk TAVR data. Despite it being leaked yesterday, which was a big news event, it was neat to see, the two key opinion leaders for the Partner 3 trial and the Evolute study, low risk, to present their data live, and that's to see the applause, to see the reaction, to get a sense as an end user of the technology how it's going to impact people's care. That was neat to be at. So those things are very unique to, you don't get that in the digital meeting. You really have to come here and be here to see that. Likewise at TCT in the fall, I was there in the audience when the COAP study was presented, and there was a standing ovation during the results slide. That kind of stuff is just neat. So that's what I come for.
Wonderful. Well, thank you so much, Dr. Little, for joining us. Have
All
a great
right.
rest of your meeting.
Thank you.